Hi, my name is Robert Chelle with Chelle Law, and I'm an attorney that assists veterinary associates with employment contract and independent contractor agreement issues. Today I'm going to talk about veterinary non-competes. So when I am reviewing a contract with a veterinary associate, what are some things to think about when it comes to the non-compete, what needs to be in it, and then some red flags as well. So I guess the first thing to take into account is, are you in a state where non-competes are enforceable? There are a handful of states where non-competes are completely unenforceable. And so identify if you are in one of those states. Many states over the last 3 to 5 years have been changing rules in regard to healthcare providers and non-competes. A few of those states have extended those restrictions to veterinarians. However, the majority of those states have only extended them to either physicians or physicians, NPs, physician assistants, that type of thing. So my guess is 10 years down the line, non-competes for the most part will likely be unenforceable in many of the states or most. But at this point, that simply is not the case. And so I'm just going to do the rest of this video assuming that you're in a state where they are enforceable. So there are three main components to any kind of non-compete. One, you have the scope, meaning what can you not do for the period of time that's limited. Two, the period of time that's limited, so how long does it last? And then three, what is the geographic restriction? So in what area can you not practice as a veterinarian? So I'll just take each one. So the first one would be scope. What you want to make certain is that it's limited to what you're doing for that specific employer. So for instance, if you're working in a hospital and doing emergency care, it should only say you can't practice as a veterinarian in emergency care, not you can't practice as a veterinarian. This at least gives you some options. If you're in urgent care, same thing. You can only practice in urgent care. If you're in a small animal general clinic, you can only, you can't practice within a small animal clinic, and that way you could do urgent care, you could do emergency care. I would also add in a sentence that says that you're allowed to do relief work. Many times in veterinary contracts, we'll put a specific amount on it. So for instance, it would be the non-compete doesn't apply to anywhere where you work less than, 4 days a month or something like that. Or sometimes it'll be over the course of the entire year. Once again, just to provide you with options when the contract ends. The next piece is the temporal restriction, so how long it lasts. It shouldn't be longer than a year. Most states have found a 1-year non-compete is reasonable. However, if a place is trying to push it to 2 years or 3 years, that's too long, and that's not something I would accept as a veterinarian. And that's simple. It's just, you just switch the time. The last thing would be the scope, and this part can be a little tricky. So a normal non-compete would be you can't practice within 5 miles of the primary clinic where you provide care. Confusing part of this, or the part that can trip up some veterinarians, is if you're working for like a corporate-owned veterinary clinic and they have maybe multiple locations within your area, you want to make certain that the contract doesn't say you can't work at any of the clinics that are owned by whoever your employer is. You want to limit it specifically to where you are working primarily. Maybe if you're working in 2 places and splitting your time, then it would, be reasonable to say you can't work at those 2 clinics. But if you're working for a corporate-owned vet clinic and you're in a large city and they have 5 locations, you certainly don't want 10 miles to attach to 5 locations. It should just be where you provided care. And then the last thing is you want to limit it to like a look back period. So meaning only over the last 12 months. So anywhere that you've worked, or any of the 2 primary locations where you've worked over the last 12 months. Sometimes the language is open-ended and it just says anywhere that you've worked. And so maybe you've worked for somewhere for 6 years. Maybe you filled in at a location in year 1 of the contract. Well, the way that the language would work, it would attach to that one location even though you hadn't been there in 5 years. So you want to make sure there's a look back period of 12 months, which would be a reasonable amount, and not anywhere that you work for them forever. Because if you have a long tenure with an employer, you could get tripped up and have it attached to a location that just makes no sense. So that's some of the things that we go over when I'm doing a veterinary non-compete review. If you have any questions about your employment contract or independent contractor agreement, feel free to contact my law firm. All the information is listed below in the description, and I appreciate you watching the video. All right, thanks. Take care.